Hi everyone, and welcome back to today's Break for 8 for Dementia Care Partners, where we do about 8 minutes of dementia education, and when we follow that up with about an 8-minute relaxation or meditation activity just to help you feel and find a little stillness and peace in your day, with the goal of hopefully bringing that with you as you re-enter your day providing dementia care. So today, my environment's a little bit different. My house is a little noisy, so I'm kind of camped out in my daughter's old bedroom, and I hope you found a little space of quiet for yourself. So one of the questions that I see a lot on dementia boards or forums, and I've been asked it myself, is this: how do you know what stage of dementia your person is in? So I'd like to take a little time this week just to talk about what we mean by stages of dementia or levels of dementia. And I'd like to discuss or describe a couple of scales, assessment scales that clinicians use to help us determine what stage or what level of dementia your person is in. So first of all, this really may sound preposterous, but dementia can actually oftentimes follow this fairly predictable pattern. I know that sounds crazy because every day is a little bit up and down, right? But let me explain. So, for example, in most forms of dementia, more complex activities that require us to interact with our environment. So I'm talking about things like driving a car, or working at a job outside the home, or handling our finances, or even preparing a meal. Those things are going to be impacted first by dementia, and we call these more complex or difficult activities instrumental activities of daily living, or IADLs, instrumental ADLs. Now stay with me here a little bit. Activities that are more person-based, so things like getting ourselves dressed in the morning, or brushing our teeth, or eating, those are what we call basic activities of daily living, or BADLs, or sometimes we just talk about ADLs. So errors with basic ADLs show up a little bit later as dementia progresses. Now, several tools have been developed that classify the progression of dementia into different stages. And this is what you may have seen or heard about. So usually the stages of dementia are considered mild, moderate, or severe. And I think the most helpful tools, just in my opinion, use function as a measurement. So meaning they're going to describe a person's ability to participate in ADLs and IADLs, rather than how their brain looks on an MRI, or what score they have on a cognitive test. And not to say these tools aren't helpful. Also, just know that I'm an occupational therapist, so I come from a scope of looking at ADLs. But I also think families and caregivers can understand function a little bit easier, right? We can interpret what it means to make a dressing mistake, like put your shirt on backwards, rather than needing a medical school degree to understand, how to interpret a brain scan, right? So that's my own bias because that's my scope. So I'd like to talk to you about two scales today that I see a lot and you may have heard of. One is called the Functional Assessment Staging Tool for Dementia, or for short, FAST, F-A-S-T, Functional Assessment Staging Tool for Dementia. And the other one is called the Global Deterioration Scale, or GDS, Global Deterioration Scale, GDS. So the FAST is actually just an adaptation, a shorter version of the GDS. And they were developed by an Alzheimer's expert named Dr. Barry Reisberg back in the 1980s, but both continue to be widely used today, and they're generally thought of as very reliable staging assessments for Alzheimer's disease. So before I go on, I want to preface what I'm about to say with this. I want to tell you that the FAST and the GDS are specifically intended for Alzheimer's disease. So if your person, has another form of dementia, or they may even possibly have mixed dementia, which is the presence of multiple forms of dementia going on at the same time, and that's very common. They might not follow the precise pathway that's outlined in these scales, 100% of the time, right? So there could be some skipping around from level to level, or they may skip some things, or some things may overlap. And this is not uncommon. So as I'm going to describe these and show you these tools, I'd like you to try not to fixate too much on figuring out your person's exact stage, because sometimes people can fluctuate, right? And because of this, actually a lot of clinicians, doctors, neurologists now prefer to use a more basic, mild, moderate, severe classification system than the one you're going to see in the FAST or the GDS. So that said, I still think there's a lot of value in talking about these two tools, because I think they can give you an idea of what can generally, and I'm going to say that again, generally, be expected as dementia advances. It just maybe helps people not be so blindsided when they see something new come on. So say your person all of a sudden starts wearing their shirt backwards and they're not, or pants inside out, and you kind of reference the scale because it's based on ADLs, right? And say, oh, they must be kind of entering this new phase of dementia. Also think it's a nice thing for you to know about, because the FAST, at least, is still commonly used during hospice assessments to help determine when a person is eligible and meets criteria for hospice admission, because we just can't sign up for hospice anytime we want. People have to be accepted, and there's different criteria for admission. Okay, so now I'm going to put the FAST up here on the screen. Not too small for you to see. Okay, but here's a picture of the FAST, and I'll actually link to both the FAST and the GDS in the comments section, so you can kind of pull them up on your own and don't be feel so frantic about having to look through it very quickly. So, but as you can see, the FAST is just a one-page, pretty brief description of the various stages and levels of dementia progression. Like you can see, level 1 and level 2 are going to indicate very actually normal aging. But as we progress through the stages, you can begin to see when we get to stage 3, this is where cognitive impairment starts to become noticeable to others, maybe on the job or to family members. And then as we move through levels 4, 5, 6, and 7, just an increasing amount of assistance is needed with ADLs as dementia or Alzheimer's disease advances. And interestingly, in the scale, you can see also that there's some research that's been done, that shows a correlation between the different dementia levels and mental age. And I'm not going to spend a lot of time on this, but I just like to point this out because I think it can give care partners a little more insight and compassion when it comes to understanding why our person is making a mistake. So for example, let's look at the FAST level 4 on this handout. So FAST level 4 correlates to a mental age here of between 8 to 12 years old. So would we expect an 8 to 12-year-old to be able to drive themselves across town and find their way back home again? Or would we expect a child really that age to pay their taxes? So I think sometimes seeing it laid out like this or presented like this often helps us kind of have that aha moment where we realize just how difficult some of these routine tasks, especially IADLs, can be for a person living with dementia. And then we can begin to recognize that they really would benefit from more support. Okay, so quickly, and I know this is a ton of information, that's why I thought we'd try to cover it each day this week. So let's move on to the GDS, or the Global Deterioration Scale. And like I said, it's basically a more detailed version of the FAST. Also comes from the work of Dr. Barry Reisberg. And I think this is where families may be able to read the description of each level, because it's a little expanded, and resonate with the signs and symptoms that they are seeing in their loved one. The other reason I share it is that the GDS can help provide, a bit more of a roadmap for us to help us understand what likely is coming up next. And it can help guide decisions around the level of care and supervision a person now needs or is going to need in the future to feel safe and to feel supported. So whether that means understanding when it's time to hire a home health aide or make the transition to assisted living or even to memory care, the kind of reading these descriptions gives us a good idea about what level of assistance they will need. I think it also helps care partners start to think about, what they are able to do, what kind of support they are able to provide, and when they feel like they're going to need more help. So if someone is stopped walking or become incontinent, maybe those are things that certain people don't feel like they can handle. So again, I'll put a link to both of these documents in the comment section. And then next time, let's dive into the GDS a little deeper, because there's just a lot there, right? And I don't want to rush through this all in 8 minutes. So for right now, let's just take our minds off the handouts for just a little bit. I know it's a lot of information. You may be tempted just to explore that a little further, but just take your mind off that for a moment. I guarantee we'll talk about it more this week. And right now, just let's take the next few moments for you, to focus on you. I'd like you to get comfortable, just begin to settle in, settle your mind, take a breath, settle your body. Let's just take the temperature down a notch. Start drawing your attention to your breath. Take a few deep breaths here, just imagining the bottom of your lungs filling up first. And then when you exhale, release that breath in a slow motion exhale. Take a few moments here to focus on your breath and allow your body and mind to follow its rhythm and begin to relax. If there's anything in your environment or your own mind that is pulling your attention away, can you begin to bring your awareness to it without feeling the need to respond? You can even try greeting the distraction. For example, you can say, "Oh, hello, to-do list. Hello, annoyance," and so on. And if there's nothing there, that's wonderful. Just sit back and enjoy this present moment of stillness, peace, and inner quiet while the rest of the group arrives. In dementia care, sometimes there are things we can change. But often the things that we attach our mind to are actually entirely out of our control. When we can't do anything to change or control a situation, what we can do is begin to release its control over us. So the next time you feel yourself butting up against something you can't change or control, I invite you to simply ask yourself, can I control this? Because often the awareness that something is totally beyond our control is the first step in releasing its control over us. And we can begin the process of releasing something that we have been holding on to a little too tightly. Letting go often has the immediate effect of releasing tension in us and everyone around us. I invite you to linger here a little longer, just enjoying stillness, enjoying this space of relaxation that you have carved out for yourself today in this moment. I'll let the music play out a little longer and I'll see you next time. Good luck today.